As 17th Surgeon General of the United States, I realized that we had a sick care system, not a health care system. We have a mounting disease and economic burden that is continuing to grow, and until we embrace pursuing optimal health and wellness through prevention strategies, through improving health literacy, we will continue to have problems with the healthcare system. But there are solutions before us, the solutions that all of you are implementing at Berkshire Health Systems.
We have gotten very, very good at treating illness, and third-party data indicates that we're one of the best anywhere. When you look at the general wellness of our community, though, we don't do so well. And what I see the opportunity ahead of us is if we're patient and we have good programming like we have now available from our wellness programming, from Canyon Ranch Institute, we can, in little steps, develop a culture of wellness that is infectious, and that's the goal.
The Canyon Ranch Institute Life Enhancement Program is based on the model at Canyon Ranch that's been around for decades. It's about taking the best science and translating it into usable elements to improve a person's health.
We've had a successful history and experience with wellness programming for our employees and for some of the larger corporations that could afford to provide this kind of support to their employees. But in our community, so much of the community doesn't have access to the same benefits that I've had and enjoyed and our employees do. And when I learned about the program, we thought it would be something that we could do to be sure that every member of our community ultimately has the same opportunity we've had, we as employees here at Berkshire Health Systems, to learn how to gain control of their lives and to live a better life and to take control of their health. And it's been a wonderful experience.
Well, I think of the Canyon Ranch clinical model as basically an integrative health model. And I think what we've all been looking for in healthcare, quite frankly, is exactly that model. A model that looks at not only the clinical challenges that an individual faces, but also the behavioral challenges and the spiritual challenges that they face. And I think this model is exactly what we've been needing both in American healthcare and more specifically here in the Berkshires.
You know, at some point in our life we talk to somebody about dieting, and then we talk to somebody about exercise, and we talk to people about our mental health and maybe go to therapy. But the program puts it all together and integrates it in such a way that you understand that it all needs to be present in order for this to work.
It is the mind, the body, the spirit, looking at not just traditional medicine, but other alternative therapies or preventative measures that we can take to help somebody live a healthier life.
That integrated health model, in the medicine model, the social work model, or the behavioral health, the choices we make in life, how happy we are, the nutrition component, because that's a big piece of what we are, as well as the exercise piece, coming together and giving that information in a pretty clear message for folks that they can take small steps to make changes in their life for their better health, for their better outcomes. And the Canyon Ranch Institute program really dispels lots of myths about it's really hard or it's really expensive. It's not. We teach people how to exercise in their living room. We teach people how to make better choices at food pantries, or how to save money on your grocery bill while eating healthier. We had a great quote from a participant this last time that said, you know, I save money because I don't drink soda. Water's free. So imagine giving up some of those habits that are unhealthy habits and really learning to turn those into healthy habits in the future.
I'm eating much healthier than I ever used to. I'm more aware of reading labels on packages. I'm more aware of eating whole foods, what's more healthy for me.
I've tried so many different diets, and I've tried to diet by myself, and nothing ever worked. You know, because diets were always temporary fix to me, and I didn't realize it. What I needed was a program like this with a whole body, lifelong, healthy approach to life. They asked us to make a little goal, and one of my goals was to be able to walk up the stairs holding a bag of groceries. And I was thinking I would be able to walk up the stairs and hold this little bag, but I am able to walk up the stairs holding 2 heavy bags of groceries and not hold on to the rail and keep my balance. And that is so amazing to me. It really is.
I've changed how I eat. I've changed the way I shop. Just feeling better about myself, knowing that I'm actually doing something about my weight and my health.
It was eye-opening, walking through the grocery store and seeing everything in a new light.
There's really nothing else like it. There's no other program that someone can go to and get the combination of a group setting and individual counseling by doctors, nurses, nutritionists, exercise physiologists, psychologists. There's nothing that's just rolled into one package.
I like it when people tell me, oh, you look so healthy, you look great. You want to enjoy your grandchildren and you have to take care of yourself, so you're here, to hear the laughter and do the fun things that you want to do with the grandchildren.
It was the most important part of my day. Interestingly, I started to learn things about the program that I could actually change in my life so that I could be healthier. So I was actually not only on the core team, but I was actually kind of secretly attending the group sessions to learn more about myself and my own health.
One of the biggest things that was most moving to me as I do this myself and then help lead others in the process of joining that teamwork in the community that we have in the wellness is to have them imagine themselves as a healthier person in the beginning part of the program. And then in the individual sessions, often we build on previous successes that they've had.
I'm out there doing exercise and going to the gym. I'm just so much more active than I used to be. I have a life now.
The mind-body approach is very important for helping people really sustain change in a way that it shifts people's thoughts from what do I have to do to being present with what is and being present to make that choice. What we talked a lot in the program was the pause. What is that pause? So before you automatically reach for something to eat, automatically decide how to spend your time, how to respond to a stressful situation, you take a pause, you take a breath, you become mindful of the choices you have to make at that moment.
I'm giving myself time to relax and do the things that I really love to do with my family. One of the really big ones is trying to take stress out of my life because stress doesn't get anything done.
Some of my pre-assessments were very emotional. People were in a tough place, and that's why they were here. They're looking for help, they're ready for help. And so 8 weeks after, I was actually surprised at how much of a turnaround that emotional sense was.
You get in touch with yourself mentally. I meditate quite a bit.
I don't think we realize sometimes what people are going through when we see them on the sidewalk and in the grocery store, when people are just going through their day. There's lots of loneliness out there, and a program like this that brings people together who are working together on a common goal for themselves was really powerful.
I thought the group was amazing, just as amazing as the staff. I think I connected with every single one of them, things that they said, things that they brought to the group, and a lot of humor. It was nice. It's something that you need support with. I don't think you could do it alone. I know I couldn't.
The biggest thing is that I stepped out, and you guys let me and showed me that I can be a better person.
Without even being conscious of it, it's like you start to develop this camaraderie in the group. People start sharing their experiences. I found myself being more open. So the camaraderie is just invaluable. The classes for the alums, the reunions. It's like, okay, I'm putting that in my calendar book because I have to make sure, that I'm available for this because I'm going to come back and be infused with all that positiveness, that I experienced while I was in the class.
To watch the changes in the participants and to see how they helped each other and to be part of having them be comfortable and be reassured and be positive and to support each other was really quite a special experience for me.
We had a 67-year-old woman that came in using a cane, and at the end of the time, she was teaching us the twist. That's amazing, and that's amazing for her to have that experience. So, though it might be very individualized, the ripple effect through the community will happen. And the hope is that we will tell two friends who tell two friends, and it'll just grow from there.
My daughter had just been diagnosed with type 1 diabetes, my 10-year-old, and so really everything about the healthy portions, about the importance of the exercise every day, almost every lesson that we went over in the class we talk about, and they're sort of part of our daily conversation in our house. So we have this joke, and it's a nice joke, but I was like, are we feeling enhanced? Is our life feeling enhanced? So we have this check-in in our house about that, so we're all, it's a culture in our house.
My son sees his doctor regularly, and we went for a follow-up visit. So it was about 30 days that he was had been into the doctor, and because he is being active, and especially with his diet, he lost. Actually, now it's probably more like 10 pounds, but it was about 5 pounds that he had lost, and the doctor was so proud of him. So that was a really great experience, and he felt so proud of himself, and he didn't even really, he said, well, I'm on a diet, but I said, not really, you're just eating differently. I said, you're not really dieting, and he felt so good. My dogs love it too. I'm walking them more, so they're getting to go a lot further than before. My feet feel a lot better too, which is great. So physically, I'm feeling a lot better.
I actually have shared the information that I've learned from this program with my family, especially the fitness aspect, the food aspect, which I can't just change my diet plan. It has to be something that we can all do as one. I have certainly shared it with my coworkers who I see as my family, extended family, and they've seen the difference. The commitment from top to bottom, from Dave Phelps, his story, right on down to me. And the commitment that we all in between all have towards the program is the same. And we've all taken the aspects of this program to heart, and I see that everyone has made some change in their life that has been quite impactful.
It is a significant investment we are making in the people required to implement these programs. I think people know Dr. Pettis and his background and his passion for this work. We made a significant commitment to Dr. Pettis to be part of this effort so he could lead it. We have indicated to everyone involved that this is a long-term commitment we're making to improve the health of our community.
I have the vision of having this community be one of the healthiest, if not the healthiest community in the country. And it sounds crazy to think that way, but when you experience the possibilities that a program like this can offer, and you find and you see people getting better, you start to believe that it's possible.
I think the first round was nothing short of a spectacular success, quite frankly. I was fortunate enough to attend some of the final sessions and hear directly the feedback of the participants in terms of the changes that they have been able to make and the impact of the program upon their lives. And I think that impact was profound, not only in terms of weight loss and measurable clinical changes, but I think more importantly in terms of their attitude and their sense that they could accomplish things, that they could achieve a life that was in balance and was focused on wellness.
For me now, Berkshire Health Systems is real. It's folks that care, and I also recognize it as a real resource.
The staff absolutely cared about me, you could tell. They weren't just doing a job, they really cared about me and what was going on in my life. And so I really appreciated that and learned a lot from them.
I was deeply honored to be invited to be part of this team and this project, and I was very excited because as the Director of Wellness, this is bringing wellness out in a very integrative, proven model to the community and to the underserved.
I'm exceedingly grateful to be part of the team because it was such a great fit for me, and the timing was perfect.
Dave Phelps, the presentation that he gave, he was so down to earth and so involved in this, and you could really, really see it in his face how much he cared about the community and about every single person. Just like at our meetings, he was there every week. He did the exercises. He did everything with us. So did every member of the team. They didn't ask us to do anything that they themselves didn't do. It was wonderful. It really was.
I'm very thankful, very, very thankful.
My 50 years of life, I without hesitation will say this has been the biggest life-changing experience that I've ever gone through, and I'm so thankful for that. Making this available at no cost to the participants, where we go and we learn all these things, and it didn't cost anything to people. I've learned from the program that it's not massive changes that we have to make to become healthier. It starts with small changes that, as you build upon them, they create bigger changes. But it doesn't need to cost people a lot of money. It doesn't need to take a lot of their time.
What I was reminded about in the class, it was the power of laughter. You know, when we laughed a lot together, and it was nice.
I cannot thank everyone enough because I know that financially I could have never participated in anything like this, and it was a great gift that everyone has given to me, and thank you very much.
I have made the statement more than once that this program saved my life, and I truly believe it.
Berkshire Health Systems is an ideal partner for Canyon Ranch Institute because we're both aligned very much in our values. We both have a passion for improving the health of communities and individuals, and we both realize that that really is the path to success, and Berkshire Health Systems has an extraordinary reputation for doing this, so we're happy to partner with them.
I want to express my appreciation to Dr. Carmona and the team at Canyon Ranch Institute. They have been wonderful partners and demonstrated a special interest in Berkshire County and Berkshire Health System and the work we're doing here. I want to thank the Board of Trustees of Berkshire Health Systems. Without their support, and they've been supportive right from the beginning when we first introduced the concept, we wouldn't have this wonderful opportunity to celebrate the work we've done and the successful completion of our first class. I also want to thank our core team members. They have made a tremendous personal sacrifice in all cases to be part of this and to see it through, and we'll always be grateful to you. Thank you for all you've done.
We teach people how to take small steps to make changes in their life for their better.
I absolutely have every intention of sustaining all that I've learned and even more.
I really felt like this was a gift that was given to me.
I'm very thankful, very, very thankful.
Feel much happier, which is very important to me, and I'm proud of myself.
The small changes add up.
I just feel really good that I have the rest of my life ahead of me.
I just want everyone to know about it. It just changes your life.
This program saved my life.